First off, thank you very much for coming out in this rainy night for the seminar. I'm really excited to be here. My name is Joann Randall, and I'm a reproductive specialist from the Chicago area. And I come here 3 days a month, every month, and we're putting in the whole repro practice here at UVS. I've had a lot of people ask me, why did you choose UVS? You know, why you come all the way from Chicago to Pennsylvania? This is a great clinic, and those of you who have gotten a tour, have seen the clinic, they have everything here. And this is a clinic that has state-of-the-art MRI, CAT scan, surgery. Neurology is coming a couple of months, I believe. Isn't there a neurologist signed on already? Yeah. This is Dr. April Horrible over here. She's equine, so there is a whole equine component that we're adding in as well. But as far as the dogs, a big plus, too, is that it's 24-hour. And as you all know, when you're whelping bitches, it's always at 2 in the morning. So there are 2 veterinarians that are here, so they know all about that as well. I assume you're a veterinarian? No? What do you do?
I'm just a breeder.
Oh, I thought you said you were a doctor somebody. No. Oh, okay. Well, then you're up at 2 in the morning, too, with the rest of us, right? So it's important. So that is why I chose this facility here, because they have everything here. I mean, it's everything under one roof. It's an awesome place. So anyway, onward. Seminars that I do are very informal, and they're very interactive. I learn a lot from you. Hopefully, you'll learn a lot from me. So please, ask questions along the way. It's hardest when you get to the end and then find out that there was a lot of questions and you can't remember 3 slides back or whatever. So please, just informally pipe up any suggestions you have or ways that you're doing something differently, and we'll go from there. So there's a lot of information that you will come across. Unfortunately, right now, we have a lot of bad information on Dr. Google. So there's a lot of great information online. There's a lot of bad information. So kudos to you for going to seminars and trying to learn as much as you can. It's important to do all of your decisions on your breeding program based on research-based and not hearsay. We get into a lot of trouble with hearsay. So basically, some of the topics that we're going to, hopefully by the end of the night, you'll be able to answer all these easily. Questions are, how are you going to breed your bitch? Are you going to use surgical? Are you going to use natural coverage? Are you going to do transcervical? How are you going to know which is the best form of option that you're going to be taking? What kind of semen are you going to be using for your program? Are you going to be using fresh semen? Are you going to use chilled semen? Are you going to use frozen semen? When is the best time for using each one of those, and why would you choose to do it? And when is the best day that you're going to breed? Are you going to breed day 8? Are you going to breed day 12? Are you going to breed day 10? When are you going to decide that you're going to breed? So hopefully, again, by the end of the night, you should be able to answer this. At the end of the presentation here, I do have 6 case studies that you guys are going to have to answer questions on. So I have candy bars to the people who win. I can bribe you guys. Okay, so first off, before we talk about breeding, let's talk about pre-breeding just a little bit here. So we have 3 major parties that are involved. We have the stud dog owner, we have the bitch owner, and we have the veterinarian. So who's responsible for what? So stud dog owner, health clearances, obviously, chick, brucellosis. I'm a big advocate of brucellosis testing. Brucella canis, as those of you who know, is a deadly to a breeding program. I mean, I have had too many people that will say, well, you know, I'm not worrying about brucellosis, there's antibiotics for it or whatever. There's not. There's not. The way that you treat brucellosis in your breeding program is to eliminate your dogs, because it lives in the cells, and the antibiotics, you can put animals on antibiotics, place them in homes, that type of thing, but they shed all the time. The biggest thing with brucellosis that I do want to say, yes, it is sexually transmitted, but the most common way of getting brucellosis is ingestion. So you go to a dog show, a dog has gone by that maybe is urinated or passing some vaginal discharge, your dog licks and sniffs, that's all it takes. So be careful at dog shows. You will have your own X-pens. Don't share X-pens. Don't walk your dogs around. Let them sniff. Just be careful. So health clearances, the stud dog is responsible for. Divulging history and problems. You know, the only way we're going to improve our breeding program is for people to come forth with what problems they have in their lines. And nobody wants to do that. So I think it's great for people that do. No, there is no perfect. You know, unfortunately, every dog has some problem, some sort. And if we can all come forth with it, we can help make things better. Contracts. Oh boy, I've seen some ugly fights over contracts. So just make sure this, if you have the stud dog, that you're getting everything into your contract as far as who's paying for what. If somebody is leasing a bitch and using your dog, how are you going to get paid? Are you going to be taking a puppy? Are you taking first pick? Are you being paid financially? And another thing too is you as a stud dog owner put in your contract that you will only breed your stud dog based on progesterone timing. Because what happens, I've seen this happen so many times, you send semen, the bitch doesn't get pregnant, what's the first thing she's going to say? Oh, it's that stud dog's fault. And your dog is getting trashed when maybe they didn't do timing, maybe there was some infection problem, maybe there was something with the bitch. So always make sure that you are sending semen to them if you're doing chilled semen or you're doing breeding based on when she's ready so that you're covering yourself. Dog availability. Obviously, if you're breeding, you need to make sure that you are not on the West Coast when somebody wants to do a natural coverage here in Pennsylvania. So your responsibility is to tell them where you're at and what's happening. Current semen analysis. I'm really big on this too, and we'll go into this. The bitch owners and those of you who have bitches, you know how much you're spending to get a dog ready for breeding. You know, you've got your health clearances, you've got your progesterone timing, you're doing all this work, and then you get bad semen. You know, that's so just make sure that you have the right to ask the stud dog owner for a semen analysis. And so many times at the clinic, I'll ask the bitch owner, I'm like, okay, so did you ask them for a semen analysis? No, I'm afraid they won't breed my dog if I ask them for that. No, they should get a copy of a semen. And we'll go into a semen analysis. I'm not talking about just being, here's the count, or I put a drop under the microscope and it looked fine. I'm more concerned, semen analysis, 3 factors, and we give these to bitch owners and have them forward them on to their stud dogs. I'm concerned about concentration, all right? Normal is 300 million to 2 billion, depending on the size of the dog. So you want to know how much you're getting, how much motility, how alive is it? You know, we want at least, I mean, if we can get 95%, that'd be great. But if we can get at least 70%, I'm happy. You know, but the more the better. But even more importantly is the morphology. And the normal to pass a semen evaluation is at least 80% normal semen. You know, do we have normal heads? Do we have normal tails? Do we have coiled tails? Do we have detached heads? So this is a full semen evaluation, not just looking at a drop under the microscope. Okay, so there's what we're aiming for. This is a good drop of semen. Modally, you can see they're going forward. They look great. This is the goal of just looking at motility-wise. And it's very concentrated, too. You can see you can't hardly see the slide. A clear spot. There's semen going all over the place. So that's our ideal goal. Okay, the bitch owner. What are we going for her? What's her responsibility? Again, health clearances, chick brucellosis. Chick numbers. I get a little irritated with chick numbers because I think it's great that every breed has put out there what is their health problems and what they think that needs to be treated. That's great. My irritation with them is that just because you get a chick number doesn't mean you've passed. And that's kind of confusing. A lot of people will say, oh, I've got a chick number. Well, that's okay, but that doesn't mean you've passed all those tests. That means you've done all those tests. So as long as you just know the difference between, you know, that a chick number doesn't mean that they've necessarily passed of it. Again, CHIC stands for Canine Health Information. I just put an example up here. This is my breed. I breed German Wirehair Pointers. So for them, there's requirements, and then there's optional. So that's how it's listed. Breed history and any problems, again, this is the responsibility of the bitch owner to come forward and do timing. Progesterone timing is a big one. We're going to get into that. And again, understand your contracts when you have when you're breeding your bitches. Veterinarians for health clearances, breeding, again, doing your timing, your inseminations, and make sure that the veterinarians that you're using are available emergency-wise. Because, again, most of the C-sections that we do are in the middle of the night, and there's always issues then. Okay, so quick overview of bitch anatomy. So when we talk about the different breedings, we know what we're talking about. This is a reproductive tract taken out. So you're looking at, just lay it on the table. So the ovaries are up there, the uterine horns are down here, the uterine body, the cervix is underneath here, the vestibule or and the vagina down here with the hair. Okay, so there's looking at it all taken apart. Ovarian activity. So let's talk a little bit about what's going on with the ovaries here. So when a little puppy bitch is born, she has all of the follicles that she's ever going to have her whole life. They're just like people. You're born with what you have, whereas the males make new sperm all the time. The follicles that she's born with, that's it. She doesn't make any more. So when she comes into season, a certain number of them start to get stimulated. So these are kind of quiet. These are quiescent follicles. And then they start to, they're chosen to, they're going to be the ones that are going to ovulate. So then they start to get stimulated by the hormones, and they get bigger and bigger and bigger, and then they ovulate. And then this structure right here in the ovary, part of the follicular wall here, starts off making estrogen, and then it transitions and makes progesterone. Now the bitch is kind of unique in that she starts making progesterone before she ovulates. Any other species, the cow, the horse, they ovulate and then the progesterone is made. But the bitch, we're lucky that she starts making it ahead of time because that's how we do the timing. So then once this ovulates out, now this structure continues making more and more progesterone, and that's called the corpus luteum. This is the structure right here that is maintaining your bitch's pregnancy the whole time. That's it right there. In other species, the placenta will make progesterone, but in the bitch, it's only the corpus luteum. Okay. The picture on the right is just a picture of actual ovary, and these are CLs, or corpus luteums, right there. So you can kind of see what they look like. Here's the ultrasound of a corpus luteum. In between the arrows there, you can see that kind of area where it's a little bit circular and dark. Okay, so let's talk about the estrus cycle real quick. Anestrus is that quiet time, 4 to 5 months. There's nothing going on. There's no vulvar swelling. They're very mentally alert, and they will listen to you when you ask them to do something. This is the great time. A lot of people don't like bitches because they're not like this all the time, whereas males tend to be that way. Then we go into proestrus. Okay, this is where she starts to bleed, she starts to get swollen, she gets a little attitude going. She will allow males to approach her and sniff her and be interested, but if they try and mount her, forget it. And the main hormone that increases here is, anybody know the name of the hormone? What hormone is responsible? Estrogen, right. Estrogen is the main one that is for the proestrus. Then we go into estrus. Okay, so now we have days where, not about 9 days or so, but there's a big range, 4 to 24, where she has the vaginal discharge, as you all know, starts off bright red, like you stuck your finger, kind of starts to get lighter, then it gets thinner in quality, gets almost straw-colored. The vulva is not as big, it doesn't look like a baboon as much anymore. She starts to flag, meaning if you touch her on the side, she turns her butt, she puts her tail up, and this is when her most time of receptivity is right here. So now, during the estrus time, we're getting a decrease in estrogen because the estrogen, again, is responsible for all the edema and getting things going. And we get an increase as we go into estrus of progesterone. Okay? Then we go into diestrus. This is the time after the heat cycle. Okay? Vulva, it goes all the way back to normal size. There's no discharge. The male can get near her, but she will eat him. She's done. She is done. And this is defined by vaginal cytology. And what that means is, if you do vaginal smears, I'm sure you've been to your vets and had vaginal smears done where they stick a swab in and roll it out on a slide and look at it. The next slide, I think, will show what we're looking for. We're looking for changes in the cells. We'll get into that. So in diestrus, your estrogen keeps going down. The progesterone is up first, and then it just kind of dissipates. Now, this is another thing that's unique in the bitch, is that the progesterone stays high for 2 months whether she's bred or not. Okay? And it's actually, that is the reason why pyometra is an issue. Because the progesterone damages the uterine wall a little tiny bit every time she comes into season. And when they normally go into heat, the cervix opens up. There's always bacteria in the vaginal canal. That's normal. There's a normal flora there. So when she's in season, cervix opens up, all that bacteria flush into the uterus. But in a young bitch, her uterus is healthy. So by the time that cervix closes, the white blood cells have taken care of the bacteria. Everything is clean in there. Cervix closes. Everything's good. Well, now you've got a bitch that's 5 years old. She's had maybe, 5 times 2, 10, maybe 9 cycles, if she cycles every 6 months. That progesterone has been pounding on her uterus for 9 cycles. And now we start to get these little cysts that form in the uterus. The cysts get bigger and bigger, and the uterus is not healthy anymore. So now the cervix opens up, all that bacteria flush in, but the cervix closes before the uterus, unhealthy uterus, can clear it out. So the cervix closes, she's out of heat, Now we got this perfect incubator. We got bacteria, we've got some blood, we've got warmth, and about 4 to 6 weeks, we got a pile. So the progesterone, this is the whole reason why pile is such an issue in dogs and not other species, because of that progesterone being the high for 2 months. Okay, so decreased estrogen, increased progesterone initially, and then by the end it tapers off. And interestingly enough, when that progesterone drops at the end of the 2-month period, that's what stimulates prolactin. So that's where you get your milk. So false pregnancies are a normal thing because you get that progesterone that goes off, prolactin goes up, and she gets milk. So false pregnancy is normal. That's not an abnormal thing. Irritates you guys in the show ring because now you got these big boobies running around, but... Okay, so this is just another chart looking at what's going on. So here's the anestrus time. You can see the estrogen's going up, proestrus, it's way up, and then it just kind of tapers off. We go into the progesterone, and it kind of stays down until she starts to come in a little bit, and it goes up, and then it peaks, and here's diestrus, and it stays up, and then just slowly goes out. Okay, at the 8-week time, and then you're done. So, a luteinizing hormone. We are going to talk about that one a little tiny bit. Luteinizing hormone is a hormone that's from the anterior pituitary gland, and that is what tells the follicles to ovulate. So when we do frozen breedings, luteinizing hormone is one of the factors that we monitor because the luteinizing hormone spikes up here usually 48 hours before ovulation because that's what's telling the follicles to ovulate. So this is very, very a succinct time. It just goes up, and usually 48 hours they'll ovulate. When we're dealing with frozen semen, the semen, when you thaw it, only lives 12 to 18 hours tops. That's all you get. So your timing has to be spot on. Now the problem with ovulation with bitches is that 4 to 10 is ovulation. We always say 5. That's kind of, everybody thinks 5.0 is ovulation, but you can have a bitch that maybe she ovulates at 4 or at 6. So if we time it with LH as well, we can get that window down a little bit lower, and we'll talk about that a little tiny bit. Okay. So why do we need to know the ovulation date? Well, we need to know it depends on how we're going to be breeding her. If we're doing surgical or if we're doing transcervical or natural, the timings are a little bit different. What kind of semen are we using? You know, we just talked about a little bit that frozen semen only lives 18 hours. So we need to know exactly when she ovulates. And if you're ordering semen, if you're doing chilled semen, when do you order it? We need to know when she's ovulating so we know when you go ahead and order your semen. Mandatory to know that. A lot of bitches don't show you when they're in season. How many of you have had bitches that you hardly know when they're in? And then all of a sudden, oh, she's out, and you missed it. So if we can watch her with ovulation times, we can catch her by doing progesterones and see where she's at. So, whelping date. I'm a real big believer of doing progesterones, if for nothing else, that you know her whelping date. It's 63 days from ovulation, not from when you bred her. Okay? And the reason that's so important is down the road, say you breed her and you didn't do any progesterones. We just had this happen last week. Somebody called up, their bitch was at 58 days, they thought, from the breeding, but they didn't do progesterones and the bitch was having some problems. So now we're like, uh-oh, you know, where are we at with the cycle? You can't do a C-section any sooner than 4 days before due date because the lungs aren't developed. So it's really a big help if you can do some progesterones. If you can do it to ovulation, that's great. If you can't, and you at least can do a couple of progesterones, it helps us gauge when she is going to ovulate. Average bitch ovulates 2 days after LH surge, that should say, but you can't see that. There was a study that was done of 50 problem bitches, and here was they ovulated 7 to 22 days. Look at that range. That's huge. That's a huge range. So not all bitches read the book, what they're supposed to do. That picture in the corner there is Afghan hound semen that was 29 years frozen. So you can freeze that stuff for a long time and still get puppies. So how do we figure out the ovulation time? Well, vaginal cytology will take you to a point. And what we mean by that is you stick a little swab in the vaginal canal, roll it on a slide, and you look at it. And a bitch that's not in season, this is what you're going to see. These are called parabasal cells, and this is the type of cell that you see. They're called non-cornified because they're kind of round. And if you look at, there's a big nucleus, a nice round cell. These cells are lining the vaginal canal. So like there's a cell right here, and there's just a couple layers thick, and then there's the blood supply. So these cells are being fed, they're happy, everything's doing good. So now your bitch comes into season. Estrogen, wonderful estrogen, creates all this edema. The vaginal canal gets all swollen because it's preparing the body for breeding. for natural mating. Mother Nature's trying to take care of the bitch. So now what happens? Instead of getting 2 cells thick, maybe these are getting 12, 15 cells thick. We're getting really thick to prepare for a breeding. But now these cells that are sitting here, only 2 cells away from blood supply, now are 12, 15 cells away from blood supply, so they're dying. They have no blood, okay? So if you do a vaginal smear on a bitch that is day 10, she's ready to breed, you're going to see this. These cells are called cornified. You see how big they are. They're kind of like cornflakes. That's how I think of them. They're like big cornflakes, and then the nucleus eventually will shrivel up and go away. This one right here has no nucleus. When you see those cells, you can say she is in estrus, but that doesn't tell you when to breed. Okay? That just tells you that she's in estrus. And we define estrus as greater than 90% of the smear cells are cornified. Okay? So it gives us a kind of a handle on when she's in heat, but it doesn't tell us when. Vaginal mucosa is another way you can look at. If you take a scope and look in the vaginal canal, we look for what does it look like. The first slide there is a bitch that's not in heat at all. If you look at the walls, they're smooth, nothing's happening. Now we have estrogen on board, so the next slide is proestrus. And look at this, it's all puffed up, kind of looks like the Michelin Man. That's from the estrogen again. The third slide is when we're breeding. If you look at the walls, they look like cobblestones. When we do transcervical inseminations, that's what we're looking at right there. And then diestrus, when she's out, it's just kind of disappearing, and it looks a little bit different. So again, vaginal mucosal walls will help you pinpoint, but it's not going to tell you exactly. LH surge, kind of touched on that a little bit. That's one way. This is just kind of a little quick diagram. Anterior pituitary, right here, the LH comes out, tells the follicle to ovulate. Progesterone, yay, ding, ding, ding. Here's the answer right here. So this is the most accurate. The progesterone starts rising before ovulation. Again, we have your range, and 5.0 is usually the number that we use. This is the progesterone machine. We run this in-house here. It takes about an hour and a half, so it's nice. You get results back right away. Without a doubt, the number one cause of non-pregnancy is, don't look at your notes. What would you guess? Is the number? Exactly. Yep. Poor timing, for sure. Now, the bitch is very unique because what happens with her, we'll skip this slide because that's kind of a more difficult slide. Okay. So this is just, you remember back in biology, meiosis and mitosis and all that? Okay, when the eggs are being formed and they're getting ready to ovulate out, they go through these different stages of meiosis. Primary oocyte has 2N, meaning it's got twice the number of chromosomes that you should normally have because it hasn't divided again. Then you get to the secondary oocyte after it's split off. Most other species, when that egg is ovulated out, they're at this stage. They've already divided, they're in a haploid number, they're ready to go at this stage right here. The horse, the cow, all other species. The human, no, not the dog. The dog ovulates at this stage right here. She's only at 2N. So by the time she ovulates her eggs out, if there's sperm sitting right here, they can't do anything. So she ovulates, then it takes another 24, 48 hours to go from this stage to this stage. So that's why there's this delay in the dog. When she ovulates, we don't breed her right away. You wait a day or two to hit that. And that is one of the reasons why with frozen, we really go late. Because with frozen semen, not all the eggs are going to fly out at one time. You have, say, 12 eggs that come out or 10 eggs. They take 24 hours for all those eggs to ovulate, then another 24 to 48 hours for this to happen. So now you're up to day 3 or day 4 after ovulation. That's when we do frozen, because we want all of them to be out and all of them to go through this before we breed. Okay, so what methods do we have available? We have natural mating. Make sure everybody is brucellosis negative. Make sure your female is ready based on progesterone. You're going to take your female to your male because your male, if you take him to her house, there's all these new smells. If you bring her into his house, there's only one new smell, and that's her. She should flag, control breeding. You know, you guys all know this. You're not going to just turn them out there. Someone's going to hold the bitch. Someone's going to hold the male. Everything's going to be controlled. We have vaginal AI. This is a pipette system. We put it in, and we elevate. There's a Mavic. This is a MOFA catheter that you put in, you blow up the cuff, and then she can walk around the room. And it's like when you blow up the cuff, it's like the male being tied to her. She can walk around the room. She can, yeah, it's called a Mavic. Yeah, yeah. So, yeah, you can order these from MOFA, Mini Tube of America in Wisconsin. Yeah. So anyway, actually going back to this right here, there was a study done where they put semen in vaginally, they elevated 10 minutes, 20 minutes, 30 minutes, made no difference. But we all do it anyway. Makes me feel better. I still do it. You know, when I stick my finger in and feather, you know, you tickle the top, you can feel contractions. And it's interesting because if you put a pipette in, fill the pipette with fluid, and you feather, you can actually see the fluid being sucked in. So I still do it. You know, do you have to do it? No, but I do it. Okay, oral transcervical is the next method of artificial insemination. I love this slide because it shows you what we're actually doing. So when you do transcervical, you're putting your catheter in, you're visualizing the cervix right here with a camera, and then the catheter goes in. You don't know if it's going in the left horn or the right horn. It's randomly going in one or the other. And the sperm will swim to the other side. You don't have to, we only inseminate one horn, but the sperm do swim. So this is a picture of doing a transcervical. Here's the scope, here's the catheter, and this is the monitor, and you can actually see here's the cervix and here's the catheter going through. So that's a transcervical. These are great. I'd say artificial insemination with chilled semen, 90% we do this way. We do frozen this way now too, which is awesome. So we only do surgical inseminations anymore now on problem bitches, older bitches, that type of thing. And then surgical insemination, where half of the semen is going in each horn. So there are advantages to surgical. Surgical inseminations, you are visually looking at the uterus. When you do a transcervical, you're looking for the opening of the cervix and dumping the semen in. You're not looking at the uterus at all. You're just looking at the cervix, and that's all. Surgical insemination, the uterus is in your hands. So if you have an older bitch, and by older I mean 5 and over. 5 and over is older for reproductively older. If we have a 5 or older bitch that has had problems conceiving, she's not getting pregnant, we want to look for cysts. The only way we can look for those is surgically. And if you feel them, they're like bubble wrap, and we can pop them. So we pop them and then put the semen in. We can also do biopsies that way, although if we have a bitch that we're not doing a surgical on, we do uterine biopsies now with them awake with the scope too now. So that's awesome. We don't have to sedate them to do that. So surgical inseminations are basically reserved for problem bitches, bitches that have had PIOs, bitches that aren't getting pregnant. We want to actually visualize that uterus. Otherwise, transcervical is the way to go. Okay, let's go to the male. You have to have a quirky sense of humor to do reproduction. Okay, semen options. There's fresh semen, collected right away. You're side by sides. You're collecting, you're putting it right in. Good for vaginals. You can do it transcervically. You can use it surgically. Best choice when you've got males with poor quality semen or the low count is to do transcervical or surgical. So if you have a male that's got bad semen and you put it in the vaginal canal is very, very hostile. Very hostile. So if you just dump that semen in the vaginal canal, a lot of it's going to die. If you have bad semen or a low count, you want to bypass the vaginal canal and go to the next tier, which is the uterus. So you're going to get more success rate. So we do most of our breedings transcervically with poor semen or surgically. Chilled semen. So this is where the semen is cooled. It's shipped someplace else, cooled on ice packs. Lives 3 to 10 days. Usage the same. It's a little bit more fragile, again, because you're chilling it down. So some male dogs do better with some extenders than other male dogs. So, excuse me, if we have a male dog that we're not sure of, has never been used before, we'll do what's called the chill test, where we collect him, and then we divide the semen up into a couple different fractions, and we use different extenders, stick it in the refrigerator overnight, see what it looks like the next day. And then that particular extender is the one that we would go ahead and use. So again, we have some that do great with one, we have some that do great with another. You just have to pick. So remember, good quality semen out the door usually means good quality when it comes in when you're shipping it. It's worthless to ship garbage semen because it's not going to look better the next time you see it. AKC does require DNA of stud dogs that you're using chilled semen on. And then, okay, so commercial extenders. This is basically if you're shipping, you extend the semen out, you're packaging it up with packages and ice packs and shipping it overnight, either FedEx or UPS. Okay, I actually received semen in this one time. It was dead, no surprise there. This is not how you ship semen. Okay, then we have frozen semen. Again, the intended usage is much later, years later. It lasts forever. It'll outlive all of us, but it only lives 12 to 18 hours. Now, I also like to use it in young, proven bitches because usually the frozen semen is on male dogs that are no longer with us, so you only have a finite amount of semen. Maybe you have six breeding units. You don't want to use it on a bitch that's never had a litter. What if she can't conceive? What if she has a problem? Now you've wasted one. So I always recommend using it on proven bitches. Have a litter, somebody else first. If she carries, she's a good mom, everything is good, then use your frozen the next time. Only used in surgical or transcervical. You cannot put frozen in vaginal. It will not survive. So you have to do either surgical or TCI. And then you store it. You can store semen. Again, DNA is required for them as well. Negative brucellosis prior to freezing. There's a lot of paperwork. There's a lot of contractual things. Freeze when your stud dog is young, please. I get a lot of breeders that come in. Their stud dogs are 8, 9 years old. They're like, oh, he's got cancer. He's got lymphoma. He's got this. I want to freeze him before I have to treat. Oh, my gosh. His semen is going to look awful. Freeze it when he's young. When you do your health clearances, he's 2 years old, he's 2.5, 3 years old. He looks like somebody that you are going to want to use. Freeze him. You can always toss it out later. You can always destroy it if something comes up and maybe he doesn't turn out the way you want, or he does, you do a genetic test that comes out, a new test, and he has something you don't like. You can always throw it out, but freeze him when he's young. Do not wait until he's old. I put this in here. This is a bull mastiff a client sent to me. This is in the summertime. And he says, my boys take care of their testicles. So his male sits on their air conditioning vent all the time. So it's like, do you do what works? So when you have frozen semen, there's 2 different ways of freezing semen. One way is in straws. This is what the straws look like. And then there's pellets. So if you know what Dipping Dots ice cream looks like, yeah. I can't eat that anymore because that is what the frozen looks like. It's in little pellets like this, and then it's stored in cryo vials in tanks like this. These are like little condos. So there's little trays in here. There's 25 little vials per tray, and then the trays are stacked, and that's how the semen is stored. So pretty much if you go to, we will be freezing in pellets here when we start freezing, and they're boxed up. Each vial is a breeding unit. So when you go to ship it, your bitch who is getting the semen will send us here the address and how much they want. Everything is done by a contract. Only one person owns the semen here because I don't want any fights. This one's fighting with this one. So one person owns the semen. Everything is signed. So if a bitch calls here and says, oh, I want semen from so-and-so, you have to discharge it. You as the owner of the stud dog have to say, yes, I am releasing one breeding unit to go to her. Everything is done. I don't want any fights. So, okay, factors that affect the semen and timing of breeding. First off, the inseminator, make sure that your veterinarian can do however it is that you want and that they are available. Again, the availability is the big key. Dates, weather, and location. I can tell you you're going to want semen on the 4th of July, on a holiday, on Christmas, or the worst blizzard of the year. So it's just the way it goes. Again, it's contract specifications. Sometimes the stud dog owners will say, I'm going to be in California, I can't get to you to do chilled semen. So just make sure that you pick the form of semen that's available at the time when you're doing your breeding. Male factors, availability of stud dog. Again, reproductive age, health status. An older male is going to depict, or what his semen evaluation is going to determine how you use the semen. If he's got bad quality semen, we don't want to use only one breeding. We want to increase the numbers. The type that we're using, whether it's fresh, chilled, or frozen. Female factors that you pick, her age. You're not going to want to do frozen semen on a 7-year-old maiden bitch. If she's had a pyometra before, we're not going to want to use frozen semen. We want really great quality semen. Does she have a stricture? If she has a stricture, you can't do a natural mating. So there's a lot of factors that you want to think about. This is the golden slide right here, and you have it in your handout. This is what you came for. When are you going to breed? So natural mating, you're going to start 1 or 2 days after ovulation, breed every other day until she either says, get away from me, or he's not interested. And usually you'll get 2 breedings and maybe 3. So that's if you're doing natural mating. Artificial, if you're using fresh or chilled, it's exactly the same time. Best days are either 1 and 3 or 2 and 4. If you only can do 1 breeding, say your bitch is in season, ready to go, and the male says, I can only give you one, day 2 is the best day. Day 2 after ovulation. Right, after ovulation, right. Day 2 post-ovulation is the best day. Frozen semen, again, it's late. Days 3 or 4. So, much, much later. Okay, your turn. Case number 1. First off, what breed of dog is this? Oh, who said Ibisons? Yay! You can pick out a candy bar. This was 1 litter. This was 1 litter. And actually, the first time this dog had puppies, she had 21 puppies.
Oh my God.
This was, yeah, this was her 2nd litter. I think she had 16. They all survived, yeah. Yeah. Okay, so you have a 3-year-old bitch. You'd like to breed her with the following. Here's her progesterone numbers. All right, let me get my candy bar. What day did she ovulate?
On day 10.
Oh, yay. Who said that? Okay, case number 2. Your bitch has been bleeding vaginally for 10 days. You think it's time to breed. So you drag out your microscope that you had in the closet, and you look at it. Vaginal smear. You do a vaginal smear, and you look at it. This is what you see. So you're going to breed her?
No.
Good. You missed it. You missed it. So earlier, under diestrus, it says in your notes that diestrus is defined by vaginal cytology. It's really interesting. If we have a problem bitch, I will actually give slides to my breeders and little swabs, and I'll mark them with the day and have them do these vaginal smears at home. Because you can watch them, and then they come in with the slides. You can watch them go through, they're getting more and more cornified. Then they'll be, say on Tuesday, they'll be really cornified, and then Wednesday, they'll do it again. And then when we look at it, Wednesday, it'll look like this. Overnight, it changes. And this is the first day of diestrus. So it's nice to know if we have a bitch that we're having problems breeding, we follow her with slides. It's not going to take, by the time you get to this point, you've already missed your breeding, but you can kind of see if you bred her when you should have. It's kind of a reverse kind of a thing. So anyway, case 3. Bitch, 2.5 years old. She's an Old English sheepdog. She's always had regular cycles. She's had all of her health clearances. You have your stud dog all lined up. What kind of semen would be a good choice for her? 2.5 years old. She's healthy. Fresh, frozen? Yeah, right. Well, I wouldn't do frozen, but yeah, you can do anything. Exactly. All right, so how are you going to do the breeding? What would be a good choice for her? She's 2.5 years old.
Where are they located?
Say they're local.
Just fresh.
Yeah, either fresh side by side, natural. Thank goodness you said natural. I cannot get a, breeders don't want to naturally breed anymore. Okay, case number 4. Your 7, you notice that? 7, your 7-year-old bitch has been bred many times. But, and I get this all the time too, I got to breed her one more time because she's the best dog I've ever had. You want to breed her one more time. How do you know when you're going to breed her? Good, good, good. What's the best form to use for her? Fresh or chilled, right. And you want your male to be awesome, right? You want really good semen because she has problems, so we got to rule out half the equation. So I'd rather take a male, fresh semen, who's got settled litters. You got a history on him. He's settling litters, no problems. Great, that's who we want. Great numbers, we want everything so we know we can just deal with her. And how are we going to do, what would be the best for her? 7 years old. Surgical, right. Okay, case number 5. You're at a vet clinic with your bitch. You've done everything. You've done your breeding, your progesterones. You get your semen in the mail. Everything is ready to go. And there it is. And I can tell you this happens all the time. All the time. Actually, it's kind of interesting. This is a proximal droplet right there. That's an abnormality. See that little ball right there? And these guys, if you have a whole bunch of them, you can have this sperm swimming all over the place. And if you have not done morphology and don't see that, you think that the sperm are normal. But those guys can't fertilize. If they're alive, they can't fertilize. So these are coiled tails. There's a lot of abnormalities in this. So the lesson from this is do your stud evaluations. Make sure that he has been settling litters and he's got good semen. Make sure that he will chill good. And have a backup plan. Always have a plan B. Always have a plan B. Okay, last one. Your 5-year-old bitch had a pio after her last heat. She's currently in heat now. You do want to breed her one more time. Do you skip this cycle or do you breed her on this one? Good, good, good. What form of semen would be best for her? Right, fresh or chilled. And how you can put it in her? Surgical, right.